people like you and me who prefer to stay outside. But I think the last session is also a very interesting one, and we want to start. We learned that the UIAA provide information about different topics, and for sure we started the project 2.5 years ago to renew our recommendations on women going to altitude. And there is a recommendation, first one was I think in 2008, and then we tried to renew this, and it was a big work, a lot of people, not only from the MECAM UIA, but also other experts, mainly women. And so now we were able to publish at least 6 or 7 papers, but Kastė will go into detail. And we are also invited to give lectures on this topic this year on the WMS ISMM Congress in Utah, USA. So I think it's a very interesting topic. And now we will hear what are the differences. You know, we don't want to say, well, there are big differences between men and women. It's not this, but we want to learn more about the needs and maybe the differences in women, that we can also act properly. It's also a big topic in just normal medicine, because we knew that are differences, but normally until now most of the studies were done in average 70 kilo white man. So I think all the results from the past we have to rethink. So now Kastė will give us an overview, and then we go further in a menstrual cycle. What is the name again? Andrea Kische, she will talk about how to train as a woman. And also, for example, I have a small clinic. I have different doctors in my clinic, and one doctor is really just doing this. So, for example, in Switzerland, Europe, this is a big topic, and I think also women often do not know when they have to train how to become better, or when they should just relax a bit more. And also nutrition is a big issue. And so I think we did also implement nutrition in our papers. So this is very interesting. So please, Kastė, thank you very much.
Thank you. And thank you for the possibility to come here. Actually, I participated in this project about women and high altitudes, and that's why they invited me to come here. So I'm very happy to see the Argentina, to see the mountains, to see you here, and to talk a little. Okay, so please, men, stand up. All men, yes. Okay, I have to stand up here. A lot of you, yes? You will agree. Historically, mountains were associated with men, yes? Men were conquering the mountains, conquering the nature. Men were hunting, herding animals. They were mining, yes? A lot of things men did. But that was a historical perspective. So please sit down. And now, women, please stand up. Yeah, you see, there are more and more women participating in the mountain sports, like skiing. What do you do? Climbing? Climbing. What else? Climbing. Tour skiing. A lot of outdoors, yes. Also conservation efforts, also the exploration. Women are going there. And what we see, that women are engaged in mountain activities, the range is quite high. 15% of Everest climbers are women. 14% of Everest trackers are women. Talking about states, 33% of American Alpine Club outdoor climbers are women. And over 40% of Swiss Alpine Club members are women also. Maybe someone can tell me how many women are going to Aconcagua? The percent? No numbers? And that is the problem. We don't count women. And we don't count men as well, so we don't have these numbers. Well, and there are distinct female-specific features like menstruation, pregnancy, and also postmenopausal changes, which might have influence for acclimatization and performance at high altitude. So maybe it's worth to talk about women. If you look at the literature, well, published research on high-altitude medical conditions predominantly involves male subjects. Women tend to be in a minority, sometimes even completely excluded. And that's why we have really, really few female-specific evidence-based recommendations for women. So, as Urs already told you, 2.5 years ago, UIAA Medical Commission decided to renew the recommendations for the women. So we started the project for women going to altitude. It was quite a long and intensive work, I could say. But recently, we managed to prepare 8 documents. 7 of them, they are published already in the High Altitude Medicine and Biology journal. 1 is in a progress yet. And today I will present shortly those papers. First of all, I will talk about 4 topics which are relevant both for women and men. But in these papers, our task was to investigate if there are any differences and if there are any special recommendations for women. So we will check, okay? And in the end of my lecture, I will talk about the women-specific health issues like pregnancy, contraception, and menopause in the mountain. I want to apologize my colleagues who really like scientific things here, as I noticed before. I'll try to concentrate on practical things, okay? So the conclusions and the practical recommendations. And let's begin with the first, and it is about acute mountain sickness and high altitude cerebral edema in women. By the way, these papers, they are free. The access is free right now. And if you picture this sign, you can get these papers. This is for my scientific colleagues. Okay, in this paper, we included actually 37 publications. I would like to mention a few numbers. So there were unique female participants, 6,215. And there were, in comparison, 11,453 male participants. So that's a big difference, I could say. The majority of the publications included did not find that women are at increased risk of acute mountain sickness or high altitude cerebral edema. Of course, there was extremely limited sex-specific data on risk factors or treatment. And we concluded that there are no special recommendations for women. So women, you should follow the general recommendations, which are both relevant for men and women. Nothing is specific. The second paper is high altitude pulmonary edema in women. Here we included 6 case series plus 1 case control study, but we excluded 45 studies on basis that they did not publish female subgroup data. So they included women, but they didn't separate it, and they don't showed any differences. The total numbers, again, 120 women and 579 men. Big difference. But the findings is quite interesting. we find that the incidence of HAPE, of high altitude pulmonary edema, seems to be lower in women than in men. Of course, it's based on the very, very limited data. And we speculate that this is more because of the behavioral issues. There are a few studies on hypoxic ventilatory response, on hypoxic pulmonary vasoconstrictions, but still, I think, and we think that there might be a behavioral things. And there was no study investigating the differences between women, men, in terms of pathophysiology, symptoms, treatment of HAPE. And again, no only women group. And our recommendations for women, no special things. Just go to the webpage of UIAA or use this YouTube address, and you will find the main recommendations: how to prevent AMS, HACE, and HAPE, and how to treat. One more general topic is about the frostbite and mortality in mountaineering women. For that frostbite topic, we found only 2 studies, actually, which analyzed frostbite in mountain environment up to 7,000 meters. But these studies didn't provide gender-specific exposure data. For the comparison, we included 10 additional studies which analyzed peripheral cold injuries in lowland population. In these studies, men had a high incidence of frostbite in population-based studies, but there were 2 studies, military-based studies, out of 5, where they found that women are more at risk to get for a frostbite. So our conclusion, insufficient data, especially about mountaineering at high altitude. Well, talking about the dying, that is also interesting finding. Men are more at risk of dying at high altitude than women. But for this, we included 7 studies, 1 report, which analyzed the risks. The studies covered a range of countries, elevations from 2,000 to 8,800, so it was Everest, Himalayas data also, and a very wide period. It's around 100 years, from 1921 to 2021. From these studies, it looks like men are probably, well, as I said, that they might die. The risk of dying is a big high for men. Again, there is low equality evidence, and mostly because the sex differences of exposure are lacking. So, as I said, you don't count women and you don't count men, and you don't, and in these studies they can't show the results. The last general topic is about nutrition. We included here 13 articles. 5 studies were all included only women, and the other 8, were both men and women. In the women, there were 112 and 170 male participants. Based on these studies, we draw only one recommendation, which is more relevant for menstruating women. It is reasonable to perform a blood test and check the iron and ferritin before at least 4 to 6 weeks before a long high altitude expedition, so you will have time for iron supplementation if it is necessary. And the other conclusions and recommendations, they are similar both for men and women, and I just don't want to repeat. Adequate food, including carbohydrates, protein, the steaks, Urs loves that, and the fluid intake, the hydration can prevent weight loss and increase the performance at high altitude. Okay, so that was the general topics, and then I will move to the woman-specific topics, okay, here. So I will talk about the menopause at high altitude. Here we included 7 studies which assessed low altitude postmenopausal women during short-term journeys to high altitude, or they performed the hypoxic exercise test. For the comparison, we also included 4 studies which were done on high altitude residents. Again, I go straight to conclusions. And there is no evidence that menopause increases the risk of AMS. So older women, you should not avoid going to mountains. There are even benefits of going to a mountain, to going to the nature. And first of all, benefits to the bone density and also the mental health. And even more training before the travel might even benefit the performance at high altitude. So that could be also recommended for the older woman. I guess for everyone, training is good before the travel, yes? Whether high altitude exposure alters the onset of menopause or affects the vasomotor symptoms is not been studied. But that's why we included those studies of the high altitude residents. In those studies, they showed that the menopause starts a bit earlier in those who live at high altitude, but those women who live at high altitude experience less difficult, less disturbing menopause symptoms. So that's quite interesting things. It's not known how it is in the postmenopausal or menopausal women who live at low altitude. So we need more studies about that. We also included few recommendations for very specific menopausal health issues like osteoporosis, urinary tract infection, and obstructed sleep apnea. These issues, they wasn't studied again in postmenopausal women going to high altitude. But still, we know that osteoporosis has an increased risk of fractures, so it's clever to take measures to prevent injuries and falls and treat underlying osteoporosis. So continue on treating while walking, going to the mountains. And those women who have frequent urinary tract infections, they should consider treatment with topical estrogen and also carry appropriate antibiotics in case the symptoms of the urinary tract infection kick in during the travel. Lastly, those with obstructive sleep apnea, but this recommendation is similar to men, they should continue to use continuous positive airway pressure at high altitude. Of course, if it's available. And one more thing, that acetazolamide may improve sleep disordered breathing as well, so it might be used as adjunct to the treatment. Okay, so another female-specific topic is the contraception. It's already also on PubMed, you also can find it. For this review, we included 17 articles, predominantly reports on oral contraceptions used at high altitude. Actually, no advantages or disadvantages in hormonal contraception users was found. And we could say that hormonal contraception can be used safely for menstrual cycle control during traveling, but the best practice is to continue current contraception methods. So if you do use the contraception, continue, don't change anything, because you know already. But if you need to start one, it's better to do it well in advance, at least 3 to 4 months, because you know then if there will be any breakthrough bleedings, any bleeding irregularities, and also the thrombosis risk is a bit higher in the beginning of the use of a contraception. And for the newly started, we would recommend non-oral progestogen-only formulas. The same reasons, less risk for the bleeding irregularities, also less risk for thrombosis, and lastly, oral contraception is very dependent on the time of the day to consume, so it's very important thing. One thing, it's not very clear here, but what we wanted to mention, that both partners should share responsibility for the prevention of the unwanted pregnancy and also for the sexually transmitted diseases, infections. Let's talk about oral contraceptions, which is most popular formula in high altitude travelers. What is important? So first of all, it's important to ensure regular administration, especially if you go to the place where there are huge time difference. So it's clever to adjust the time, so you use the pill quite regularly. In case of breakthrough bleeding, which can happen, have your sanitary pads or tampons. Of course, you can rule out pregnancy with a pregnancy test, and non-steroidal anti-inflammatory drugs like ibuprofen or naproxen may be used to terminate and the breakthrough bleeding too. There's also things with diarrhea or vomiting. So if you vomit within 2 hours of oral contraception administration, you should probably take one more pill for the better efficiency, but anyway, you should follow the user instructions for this missed pill. And antibiotics, those antibiotics which we use to treat the infections, they do not alter effectiveness of these contraceptions, except for rifampin and rifabutin, that is the antibiotics which used for treatment of tuberculosis, some staphylococcus diseases, and that's not so often used. It's very important to mention the risk also of the thrombosis and venous thromboembolism. So estrogen-containing contraception has this risk, and you should talk to women who are who are taking these pills about this risk. And also, you should talk how to reduce the risk with preventive measures against other risk factors like cold, long periods of inactivity, for example, during the flight, the dehydration, also smoking, and constrictive clothing and gear. Okay, this is the paper. It's not ready yet. It's not published yet. We're still working on this paper, and it's quite important paper about the pregnancy at high altitude. One thing, we find that there are very limited data and a lot of non-evidence-based restrictions to altitude exposure. Well, so our final recommendations, they are not ready yet, as I said, but I will shortly present a few of them so you could see the general view. If you ask, can pregnant women go to the mountains? I would say yes. Women with uncomplicated pregnancies can travel to high altitude, but with caution and close self-monitoring. It's also important to take additional time for acclimatization. Acetazolamide, have it in mind, it is teratogenic, so should be avoided. And also it's important to mitigate the risk of trauma. But I guess a lot of pregnant women do so they just take less difficult routes or use full body harnesses. So it's they care, not only for themselves, but also for their babies. And there are situations when pregnant women shouldn't go. It's when they have a pre-existing pregnancy complications and underlying medical conditions that might impair oxygen transport and acclimatization, such as, for example, severe anemia. Well, so here I have few recommendations for women only. So you are not at increased risk of mountain sickness or high altitude cerebral edema. In contrast, probably men are more likely to develop pulmonary edema and die in the mountains. Contraceptives can be safely used to control menstruation during travel. It is a good idea to check ferritin and iron levels before your trip. And both older women and women with uncomplicated pregnancies should not avoid mountain travel. So thank you for the time. Thank you for your attention. And now I have can you take a picture one more time, Urs? Not with the hands, but with the women who are here. Please come here, come. All the women for the picture. Yeah?
Good job, thank you.
Thank you. So please, all women.
You can stand up there. Yeah, so
Okay.